Hi guys, welcome to 13.2 video lesson number 3. This is our last video for 13.2. We were going to talk about the two hormones coming from the thyroid gland, and looking at the back of the thyroid gland, we'll talk about what the parathyroids also do. Here we go. So we start off with locating the thyroid gland. It is right below your voice box. It's right here. Your larynx or voice box. If you hum and put your hand on your trachea, you can tell where that larynx is. So you can imagine where right below that is your thyroid gland, and it kind of wraps around your trachea towards the back, and it's kind of in the shape of a butterfly. And this is for thyroid gland will release hormones for growth and metabolism, and it will, thyroxine that's released, increase your metabolic rate, and that is the rate at which you use your food, your nutrients. And of course, the more you are doing that, the more you're doing cellular respiration, and the more oxygen you will also make. So thyroxine is the one you have to know about. They often mention, and thyroxine is a T4, meaning that there's 4 iodine molecules attached to the thyroxine in its structure. But they also mention T3 sometimes when they look at your thyroid functioning. They'll look at both thyroid hormones, T3 and T4, but you just have to know about thyroxine. So you had seen this sample feedback loop earlier, and so now you can kind of maybe have a better sense of what would happen, and that is that in response to low metabolism, your hypothalamus will make a releasing hormone, which in this case we write, instead of RH, we can write TRH, thyroid releasing hormone. That will cause the anterior pituitary to make that thyroid stimulating hormone to cause the thyroid, I'll just draw a picture of a thyroid here, to release its T3, T4, and when metabolism is increased, you can see our negative feedback arrows go to both parts of the brain, and will slow it down. The thyroxine is very necessary, and if they notice that some places in the world thyroxine is in like not being in healthy levels in people, they notice that they are deficient in iodine because that T4 needs those iodine molecules. So that is why regularly, commonly, table salt is iodized. So there, in many places, iodine being added to table salt is helping to keep that the thyroid functioning better. Here's our thyroid stimulating hormone feedback loop. I wrote here the stimulus could be something like low on ATP. We need to metabolize and make more ATP when we do cellular respiration of our glucose. We're doing it for those 36 ATP that are produced for every glucose molecule, as you recall. So when metabolism needs to go up, here's our feedback loop that you can copy. Hypothalamus sends out a thyroid releasing hormone to the anterior pituitary, which sends out thyroid stimulating hormone to the thyroid to make its T3, T4, and increases your metabolism. And there's our negative feedback arrows. This is a very, very important feedback loop, and you can expect to see a lot of questions on the thyroid, so make sure you know this one really well. The 3 disorders at the bottom will be covered in the slides coming up, but hyperthyroidism, also called Graves' disease, is when the overactive thyroid is metabolizing too much, so the person's eyes actually bulge out and they get overheated and very slim because they're using all of their stored energy. On the other hand, hypothyroidism, a low functioning thyroid, myxedema is another name for it. Edema meaning swelling. The person will start gaining weight, be cold, sluggish, will have trouble thinking. So those two, you should know both of the names, hyperthyroidism graves and myxedema for hypo. Cretinism is when the thyroid is not functioning in an infant when they're born without a functioning thyroid, and that quickly within months can cause mental retardation because their body is not getting the ATP that it needs to function. Okay, we are going to look at the other hormone coming from the thyroid before we go through the slides on those disorders. The other hormone coming from the thyroid is calcitonin, and as the name suggests, this is to release the it will increase the bone levels of calcium. So calcitonin sends calcium to the bone, and for that reason, it is reducing the blood calcium in your by putting it into the bones. This is going to be an important little rhyme to remember, calcitonin to the bone. And so that means that when your blood levels are high because you just consumed a bunch of calcium, then it's going to be sending it to the bone. There will also be, right away, you'll see that there is the opposite function where calcium is sent to the blood. When blood levels are low, it gets sent back because calcium is used for a lot of important functions, and you can record those in your notes. They are calcium is needed for bone strength, needed for blood clotting. That's something we mentioned in chapter 8 of Bio 20. Needing for nerve conduction. We talked about that in chapter 11, how calcium helps move vesicles. We also have heard about how muscle contraction happens in Bio 20 with the aid of calcium as well. The other one, of course, is teeth are strengthened by calcium. So there is a lot of reasons that calcium levels have to be monitored. And we'll check out that feedback loop coming up. The three disorders that we talked about on that list, hyperthyroidism, and reviewing that again, is overproduction of thyroid hormones. And so the person can't sleep, they lose weight, they're hyperactive, also called Graves' disease. Once it gets more pronounced and more serious, they may call it not hyperthyroidism anymore. They might start saying, well, it's now a Graves' disease. They usually use that term when it's a more advanced stage. And they could try to cut a piece of the thyroid out, but because it's hard to be accurate on how much needs to be removed, they typically try to destroy the whole thing by giving the person radioactive iodine, which naturally is taken up by the thyroid. And so they say the thyroid is always actively transporting any iodine that's floating through the blood. So it will, they have found that your thyroid may have like 25 times greater concentration of iodine than anywhere else in the body. So easily, if they give radioactive iodine to this patient, that will end up in their thyroid. It will destroy their thyroid. And you might think that that's kind of a very a dangerous thing to do. However, then they can give the person Synthroid or synthetic thyroid at the optimal amount every single day. So a pill a day can keep their thyroid levels perfect. And this is something that is a very common medication, actually. There's someone with the bulging eyes and with the hyperthyroidism, you can also have the issue of the thyroid swelling. So that's what the goiter is here, and that is visible in this patient. Okay, when the thyroid is not functioning though, hypothyroidism is when they have the mental sluggishness and weight gain and swollen face and feeling really cold. Because there's that swollen look, that's why this one's called myxedema. And sometimes it can cause a coarse skin effect as well, which is reversible if they are treated. So, interesting thing, if you have an overproduction of thyroid hyperthyroidism, that the thyroid can swell, but also, interestingly enough, if it's underproducing with hypothyroidism, the thyroid stimulating hormone may keep saying, hey thyroid, make thyroxine, hey thyroid, make thyroxine, and stimulate it and swell it for that reason as well. So there are patients in both of these disorders that will have swollen thyroid glands. So that seeing that is not a definitive sort of way to diagnose a patient. Looking at their levels of hormones is a much better way to tell if they're low or high on thyroid levels, thyroxine levels. Okay, we mentioned the baby with severe mental retardation very quickly within months. If they don't have thyroid production, they will not be metabolizing their food. And you guys can check out this video on thyroid disorders. Okay, the last part of our topic is the parathyroid gland that is found at the back of our thyroid in these four little spots, and they work opposite to calcitonin. So in calcitonin puts your calcium to the bone, parathyroid hormone will put the calcium back in the blood, and they will do that from bone matter. They will do that from making sure that as urine is formed, any lost calcium goes to the blood that way, or they will absorb calcium from the food that's in the intestines. So there's actually 3 ways that parathyroid hormone helps to replenish calcium levels in your bloodstream. You'll notice that parathyroid glands aren't controlled by the brain. So this is an interesting feedback loop. It's actually, there's sensors right in them that tell when these calcium levels are off and low, and parathyroid hormone will be directly released from the parathyroid glands and affect your bones, kidney, and intestine to get that blood calcium back up. And when the job is done, that will stop them from releasing any more parathyroid hormone. Okay, we will copy these feedback loops shortly. I just, for the calcitonin and parathyroid, I just wanted to show you this balancing effect here, because we'll see it with other hormones coming up. But you can see that the calcitonin and parathyroid hormone work opposite each other when the calcium levels are falling in the blood. Then we have our parathyroid released. If calcium levels are too high, we will have our calcitonin released to store it in the bone, and that keeps it in homeostasis. The parathyroid disorders that could happen is tetany, which is muscle spasms and nervous twitches because of low parathyroid hormone. And then osteoporosis, if there's too much parathyroid hormone, it'll continue to take so much calcium from the bones that the bones can get porous. So you can see what it looks like here in an osteoporosis patient. Okay, this is our feedback loops for regulating calcium. So you can see that the calcitonin does come from hypothalamus with a releasing hormone to the anterior pituitary to release thyroid stimulating hormone, because it is the thyroid, besides thyroxine, that makes calcitonin. And don't forget calcitonin to the bone. Calcium will go to the bone and kind of deplete that or get that blood calcium level down. For low blood calcium, it's the parathyroids that directly will sense that and get that calcium from 3 places: bones, kidneys, and intestines, and get that blood calcium back up. So please add number 5 and 6 to your collection of feedback loops. In addition, for this one, number 5 and 6, this is my last slide to share with you, is that I have told students that a really good tip in reading these questions about calcitonin and parathyroid hormone is to have this picture and draw this picture of the bloodstream here, and remember, and these are 2 bones here, and remember if your little rhyme of calcitonin to the bone. When there is a lot of calcium in the bloodstream here, it will be calcitonin that sends that calcium to the bone. If the blood has very little calcium, it'll be the parathyroid hormone that sends that calcium to the blood. And this little picture, if you can just remember, calcitonin to the bone, parathyroid to the blood, this will help with kind of wordy diploma questions that say high in the bone, high in the blood, low in the bone, low in the blood, and it can get kind of confusing unless you refer back to this diagram. And if you've got that, sketch it in with your questions that you're doing, and it will be easy to see what they're talking about and which hormone would correct that. Alrighty, and that wraps up 13.2. Thanks for joining me, and I will see you all soon for 13.3. Bye for now.